Well, Jamie, maybe you and I can catch up since we're overdue to catch up, and it's been
Yes.
some time since I seen you last.
It's been about a year to the date. Yeah.
Yeah, I think it was a little bit before the pandemic that we saw each other last.
Yes,
So,
definitely.
how's
The
that been?
It's been amazing. The last time we saw each other, you swapped out my Medtronic battery for my Boston Scientific battery, and then your physician's assistant programmed that battery for me. And I actually had not been programmed for a year, which is amazing, but I'm still doing really well. I've just chosen not to go in because of the pandemic. So I have a few shaky days here and there, but it's nothing very bad. It's, just nuisance tremor. But so I'm so impressed that I've gone a year without programming.
I'm thrilled for you. And with the older system that you had, were you able to go that long without programming, or is
Yeah, absolutely not. I actually needed programming probably every 3 months, but I was only able to get in to see a movement disorder specialist like every 4 to 6 months because their calendars are so booked.
so, Jamie, both for us to kind of refresh and take a kind of a step back for a moment, but perhaps those in the audience might be interested in this. So when we first met before surgery, just tell me, it's always nice to sort of imagine, where we were before all of this. How did your tremor impact you, and what were you not able to do because of it, or maybe what were you not able to do as well as you would like because of it?
Yeah, well, the very surprising thing for me is that I'd lived with the essential tremor for so long. I started having it as a young child that I didn't even realize how it was impacting me so much until it was gone. So I came into your clinic because it was progressing, and it got to the point where I was having a hard time getting my key in the door, even drinking a glass of water. And I was a woman in my 30s who was in sales, and
Yeah.
and that made me look very insecure as a salesperson. And my clients always thought I was just really nervous, so it got to the point, and I used to always do everything I could to hide it, hold my hands together, hold my arms together. And when I finally got to the point of acceptance with this essential tremor, I started to just come right out and tell people in the beginning, especially in work meetings, like, hey, I have essential tremor, don't worry about it, And I also, my favorite hobby is sailing. And sailing became harder and harder because you have to do a lot of minute things. And if ever it comes to having to do something dainty that's near impossible, which all of us on this call knows, there's no painting fingernails or putting eyeliner on. But those were just the nuisance problems. So when I came to your clinic, it was really progressed to the point where I had the head tremor, the no-no. I was starting to have a vocal tremor. I didn't even realize it was in my legs and throughout my entire body. So after the DBS, I actually felt this sense of calm across my body. And then as I did other daily activities, I learned that the tremor was impacting me in so many ways I had no idea.
Well, I remember meeting you, and this whole conversation, and essential tremor, as is a very common problem. Perhaps we see it more commonly in our clinics in patients over the age of 65, for example. But often this is something that starts at a young age and progresses to the point where medications no longer help and an intervention is necessary. While the majority of my patients are probably closer to the retirement age, it is enormously rewarding for me as a surgeon, but important for a patient like you to consider such an aggressive option, because without it, it would be really hard to function and have good quality of life and be productive in your career. And I think everything you just said, and everything that you brought to my attention before this procedure when we first met, just really resonated, because it speaks to if you are willing to undergo a procedure like this, the benefits that you can really see. And it's not just benefits in quality of life when you're young and still very active with your career. It really can keep you in your job. It can keep you productive. It's way beyond just enjoying life, which by itself is obviously really important and often the primary goal of my patients. But for somebody like you, and I took care of a dental surgeon sometime after your surgery. You can imagine a dentist or somebody that uses their hands professionally, how these problems can be such an impediment to not just being productive, but also enjoying what you do. So I'm so happy that we met, and that you came to see me, and sort of took a leap of faith to trust a surgeon with you. And I know that's not an easy thing to do, and for a lot of reasons, people, for that very reason, I think a lot of people are scared to have a surgery like this. And I always tell people I think that's very reasonable, but it is important, as if you're going to turn down this type of opportunity, to be well educated about the opportunity. And if you are well educated about the opportunity, the surgery itself and the device, and you still decide it's not for you, I think that's very reasonable. But I actually think if people were well educated about it, a lot more people would proceed with the procedure, because while certainly it's a little scary to see a surgeon and have surgery, and we do the surgery awake in the operating room so we can monitor tremor and monitor side effects. That can be a little scary for a patient. If my mother had to have this procedure, I know she'd be terrified. But I would counsel her, like I did you, that I think the risk-benefit ratio is very favorable, and you are just a wonderful poster child for my practice. And it's just been so wonderful to hear about the benefits you've seen. And I'd love to learn a little bit. It might be nice for the group for you to summarize this. You and I have talked, but tell us a little bit about how the therapy took a bit of a turn, where you were doing well, but all of a sudden you started developing some other symptoms that were maybe just as bothersome as the original problem that you had, but just a bit different. Could you tell me about that a little bit?
Yes, I'd absolutely love to, because that's a big question I get a lot in our Essential Tremor support groups. It was probably about a year and a half.
Jamie, before you continue, what I might ask the other participants, if you guys could put yourselves on mute, I think that would be helpful for the discussion. But Jamie, please do continue.
Sure. So it was about a year and a half after my original DBS procedure. I had the Medtronic system. I was getting programmed every 4 months or so. And my programming sessions were only like 5 or 10 minutes. They were very quick. And then about a year and a half in, I started to notice that my speech was a bit more, I don't know if slurred is the right word, but it was different. And then I noticed my balance was off when I would come in for the appointments, and they would ask me to do the one foot in front of the other, walk down the hallway. It was hard. I was wobbly. So my balance was off, my speech was off, and I didn't feel as good as I did when I originally had the procedure. And as you mentioned, it's such a big procedure, and it was a big decision to decide to get it. I was like, I want the best out of this that it has to offer. And so I would talk to my physician and be like, I didn't used to have balance issues. I didn't used to have speech issues. And the response that I would get sometimes was, well, that's just the progression of your disease state. And what I've shared with this community is that I've learned as a patient, you can't always just take the answers you get, and you have to keep asking other people or other physicians. I was in a fortunate place where I actually worked with movement disorder doctors, so I was able to ask people a few different opinions. But it's funny because that was what I did, as keep asking questions, and then I wasn't doing it for myself. And so thankfully, you have been such an open book and love sharing your time that I just went directly to you. And your physician's assistant heard me speak for 30 seconds, and she saw that something was off.
Yes.
And so what I learned was she spent an hour programming my Medtronic system. My speech got a bit better, my balance got a bit better, but I had to lose some tremor control with that session. So then I asked her proactively, what about the Boston Scientific model? And we went through those options. And so I don't know if you want to take it from there, but that's the way we decided to go. And it really, I mean, everyone's listening to me speak right now. A year ago, I was not able to speak this clearly.
Yeah, your speech is wonderful, Jamie, compared to where it was before. And a really trained ear might notice some mild tremor in there, and I think it's important to recognize that, this is a therapy that doesn't cure patients of their problem. It just makes the problem a lot better to deal with, or a lot easier to deal with. And, you've done an amazing job, doing that. And I think Essential Tremor doesn't have a champion. When people see tremor, do they think essential tremor, or do they think Parkinson's disease? They think Parkinson's disease. But essential tremor is 10 times as common as Parkinson's disease. And there are many reasons for the sort of popularity or the awareness of Parkinson's, which is a wonderful thing for Parkinson's patients. But the awareness around essential tremor is not there. And one reason for that is that there's no Michael J. Fox for essential tremor. And, he can't do everything. So, it's not a criticism to him at all. In fact, he does some essential tremor work with his foundation. But there's no celebrity or public figure that's really invested their time in trying to educate people about this very common problem. Above the age of 70, it's the most common neurologic condition. And in general, it's the most common movement disorder. And I would say one of the most common neurologic conditions across all ages. So awareness should really be there. That includes awareness of its therapies. And you had a very common side effect of this treatment. Now, that was a side effect that we used to deal with a device that is, relatively speaking, a bit out of date. Now, that company is working to try to resolve their problems. It is frustrating that it's taken more than 15 years to do that. But the good news is that there are other companies now that have these devices, and these devices have learned from those shortcomings. And, Boston Scientific is one example, probably, the best example of a device company that has options for patients with essential tremor. It's important to know, this is not a Boston Scientific sponsored conversation. They can't sponsor a conversation like this because essential tremor is not FDA approved using the Boston system. It's by definition off-label. Off-label is a term that's important for patients to understand. And the reason for that is that the majority of medication prescriptions that you get are off-label. Clinical trials that get FDA approval for a medication or a device for an indication are very expensive. And it's not feasible to do clinical trials for every single medication, for every single indication, certainly not for every device, because it requires invasive surgery. And so doctors historically and presently have been given the flexibility by insurance companies and Medicare to use their clinical judgment. And when off-label is appropriate and justifiable, it is always the right thing to do. And in this case, the deep brain stimulation system that Boston Scientific put forward is approved for Parkinson's disease. It's approved for tremor in Parkinson's disease. But it's not definitively approved for essential tremor. However, it's engineered in a way that it's structurally fairly identical to the Medtronic system, except it's much more slender, so it's safer to use. It's more durable, so it's more long-lasting. And the software inside it is much more user-friendly and flexible. So when you run into a side effect, you can actually personalize the therapy. So for somebody like you, I use my clinical judgment. You had a great tremor result, so we knew that the electrodes were well placed. Every surgeon occasionally has to address a suboptimal surgery by fixing it. And that's something surgeons do. I do it occasionally. And there may be a patient on this call who had that experience, I happened to notice a moment ago. It turns out, even if that's necessary, you can have a great long-lasting result, but it's important to recognize the problem. With you, Jamie, you had a great tremor result, but this sort of delayed side effect. So what that tells me is that you need a better stimulator, not a better surgery, but a better stimulator. And so what we did was a very straightforward procedure where we did a battery change, as if your battery was dead or it was getting depleted. But instead of putting in the Medtronic battery that you had before, we put in the Boston Scientific battery. Boston Scientific knows that their device has, much more sophisticated engineering. So they got a FDA-approved adapter. By definition, that makes it FDA approved. However, it is still an off-label therapy for essential tremor. But you should feel comfortable knowing that the adapter that was used is FDA approved. So in a way, parts of this are very much straightforward, and surgeons and neurologists should be very comfortable doing this. They might not realize that they do off-label work all the time. For example, treating essential tremor on both sides of your body with the Medtronic device is off-label.
I didn't know that.
I know. Most people don't know it. Most practitioners don't know that. Medtronic certainly doesn't remind them of that, by the way. But Medtronic is approved for a unilateral treatment. However, over time, we got very comfortable and used our clinical judgment to do it on both sides of the brain when necessary. So, for example, Jamie, when you had your surgery, it was actually an off-label procedure, but one that we had a lot of experience with. When we did your battery change, that was also off-label. However, we had about 50 patients that had great experiences with it. And you are definitely one of them. The reason why I think you benefited from it is because your electrodes were well placed, but you needed more personalization. And you needed a way for us to deliver the same amount of therapy without causing those side effects. And with the Boston Scientific system, I think that was very straightforward to do. Before our meeting today, I double checked the settings that you were on with Tracy, who you know well, is my physician assistant, but also a movement specialist and a physician assistant.
Yes.
And your settings are not complicated. It's not like it was really challenging to find the best setting for you with the Boston Scientific system. There's thousands of options that you've never even tried, by the way.
Mm-hmm.
We just did a minor tweak, but that tweak was not possible with the Medtronic system. It's actually not possible with any system that's currently approved. So, I really appreciate you kind of taking that leap of faith with me sort of for the second time. And, I still to this day remember when you texted me coming home from the hospital, you had immediate benefit just with the battery change that I think got even better when you left the clinic with Tracy when she did some minor tweaks.
Yes.
So I remember you told me you were singing in the car.
Yes. And a lot of people on this group have seen that post. I let my heart bleed for like 10 paragraphs in one post. So sorry about that. But I was so moved. It goes back to losing abilities that you don't even realize you've lost because they've been gone for so long. And so when I left Tracy that day and I was driving my hour home, and I was like, gosh, my voice feels stronger. And I turned on the radio and I started singing and I started crying because I actually hadn't sang out loud to the radio in a long time, even in the car by myself, because my voice would just kind of crack and stop. Um, so, and there are other things that happen. Like I used to think I had a hard time hiking downhill. I thought I had really bad knees. I thought they were going to buckle. I can now hike downhill and feel confident in the strength of my body. Um, so those are just some examples that you just don't even realize because you get used to not being able to do certain things.
I'm so happy for you. Are you able to wear high heels?
Yes, much better than I used to, but I still don't do the stilettos.
Now tell me, in honor of Coffee with Casey, which I mentioned earlier is this educational series I'm trying to do. This I think should be part of it as long as everyone's willing.
Yeah.
Were you able to drink coffee before all of this, or even before deep brain stimulation? Because caffeine can make your tremor worse.
Yeah, absolutely not. Actually, probably 10 years before I even went to Stanford or to see you, I had been through a series of seeing general neurologists before I even knew a movement disorder specialist existed. And one of the general neurologists I saw begged me to cut out caffeine. And he actually gave me a drug for people with narcolepsy. He's like, if you need some energy during the day, take this drug. And so that's what gets really hard about essential tremor as well, is all the polypharmacy, the multi-drugs you can end up on. And so when I learned about DBS, I kind of had to beg you guys for it for a while, because when I first went to your clinic, I wasn't quite on the threshold of approval. And then about 6 months later, my tremor had been progressing so much that when that's what I'm always preaching. Keep asking, keep asking, keep asking for change and for what you need. And it was about 6 months after I first saw your clinic, they were like, you know what, you have progressed and you are a candidate. So.
Do you feel that your neurologist or the doctors taking care of you, myself included potentially, ever made you feel that you're not ready for this? You're not bad enough, despite you feeling disabled by your tremor?
Absolutely. I mean, that was the first answer I got from a neurologist when I first brought up being interested in DBS. They specifically told me your tremor is not at a place where you're a candidate. But for years before that, I actually started going to general neurologists when I was 20 years old. Because when I was in college, I wanted to be a biology major, and I couldn't even do my chemistry class because you have to do work with the, little glass tubes and whatnot under the hood. And
Chem lab.
yes. And I actually ended up dropping the biology, my career aspirations because of my tremor, and I was so embarrassed. And so I started seeing general neurologists then, and they give me beta blockers and gabapentin and Topamax and like you name it, we've tried it.
Yep.
But I even had a couple I probably saw 15 general neurologists before I went to movement disorder clinic. And I even had a couple of them tell me, like, you're lucky, you're not that bad, and that was earlier in my disease where it wasn't as bad as it got in my early 40s, late 30s. But yeah, it's really disheartening because it was important to me.
when you got to me originally, and again, we got to know each other, even more after the surgery I did for you, the original surgery. But when you first met with me, at that point, what did you think about the surgery?
I was terrified. I was terrified up until the day it came. And the interesting part is you find out you're approved for this surgery, but then you can't actually get it for another 6 months or, whatever's going on. So then you have all that time to think about it, like, oh my gosh, I'm going to do this. Am I going to do this? And you Google as much as you possibly can. And you can't find the right answer over Google of whether or not it's the right thing to do. The best thing your clinic did was put me in touch with a patient who had DBS. And I talked to that patient for an hour on the phone, and that really solidified my decision to go ahead and go forward with this. I do believe today, had I not done it, I'm 4 years past the original surgery. I do believe I might be looking at being on disability. I turned off my battery like a month ago to see where I was, and I can't type on the computer. I can't do anything. So had I not made that decision and stuck with it, my life would be very different.
Well, I'm certainly glad you did. Would you say that after the surgery, looking back on what happened, that, was it as scary as you thought it was going to be?
It wasn't fun, but
Yeah, I hope not.
yeah, it wasn't fun, but it was not as scary as I thought it was going to be. Actually, what scared me the most was the day before when they put the lidocaine shots in your head. I was the most scared of that day,
Yep.
and that ended up really not as bad as I thought. And then the recovery is just, not comfortable, but
Jamie,
I don't have children, but I akin it to what you hear mothers say, like, it was horrible at the time, but it all goes away because it's so fabulous afterwards.
I wasn't going to mention this, Jamie, but I think I have to, just because you brought something to my attention that I think you're aware of, because you and I have talked about this. Obviously, we've got to know each other a little bit. But my practice has really evolved because of the feedback that you just gave, although I've gotten it from so many patients over the years, that why does this take so much time? I think it's important for you and for everyone to know, and Jamie, I think you know a lot of this, is that this therapy for both essential tremor and Parkinson's, dystonia, which we see in kids, it's actually approved for children, now approved for epilepsy, obsessive compulsive disorder. I actually do research on using this therapy for addiction, Tourette syndrome, obesity. There is no therapy that I'm aware of in the sort of neuroscience field that is as well studied as deep brain stimulation, both scientifically and clinically, meaning how do we best utilize this therapy for patients, who are the best candidates. We have guidelines for all of these things, and these guidelines allow us to make informed decisions that are fairly standard and across international institutions of excellence. And we use those guidelines now to make more efficient decisions. And so now, I think it's actually quite unusual for people that see me in my clinic to wait more than 6 weeks.
Oh, that's great.
And the reason for that is, first of all, I don't do anything else. All I do is take care of patients with tremor and other movement disorders. My email is literally notremorleftbehind@gmail.com. So, if you ever have a question, Jamie or anybody, you can email me at notremorleftbehind@gmail.com. So, but I'll tell you, when I get a referral to see a patient or a patient request to see me, there's no reason I can't see that patient within a week or two. And then there is no reason that I can't offer surgery within 4 to 6 weeks. The only thing that slows us down is insurance approval. Or if a patient is a little concerned or has more questions or wants a second opinion. And that happens a lot. So we do certainly, have patients that wait longer. But when patients are ready to go, this is something that, I think our clinic has really tried to address. Sort of similar to when you were having problems with that side effect. When you made me aware of it, we tried to fix it with programming, and then we addressed it with the battery change. And I think that, this can really make this therapy more broadly used. One of the reasons I wanted to have this chat with you and make it somewhat, public, is my quest with my career is to make this therapy, or therapies like it, by the way, more broadly available, because we treat less than 10% of patients that need this therapy. And so if we keep making people wait 6 months for it, we're never going to address that problem. So we have to figure out a way to be more efficient, but maintain rigor at the same time. And I think we've really been able to achieve that and take care of more patients. And it's really nice to be able to have a personal connection with our patients, and you and I are just a perfect example of that. Despite how busy I am and how many patients I see, you can still make connections with your surgeon. It's not like, this is just a, come in, get your surgery, and you never see me again,
Mm-hmm.
So it's, for me, just a wonderful thing. I think my institution really supports it, which is nice. And we have a recent patient who's an artist who had essential tremor, and I guess still has essential tremor, but it's, as you can imagine, much better now after the therapy. And she's able to do her art and have much more success with it, but also enjoy it a lot more. And our institution is doing a piece on that, which will be made public as well, as a way to try to educate people that if you can entrust us with your care for for this surgery, it can really be helpful to you. So
That's what I try to do in the support groups, because so many people are really afraid of it. Um, and I see we have a person here, Pam, on the line, and her and I consulted about changing from Medtronic to Boston Scientific. So I want to give her a clap, because she
oh, that's
just got
wonderful.
her Boston Scientific like a week ago.
Oh, that's great.
Uh, but I'm really glad to hear that you've been able to change the processes so that patients can get care
Yes.
in a more timely manner.
Yes, and for the very reasons that you said, when you're scheduled for surgery, you just want that surgery. You don't want to wait. It's terrifying, and it's a little bit unknown, and you're out of control. And the more time it takes, that day is just more and more stressful. So, when given the option, patients often just kind of want to just move forward very quickly. They've already seen so many people. They don't want to wait any longer. So we really tried to address that problem, and I think we've done so successfully. There are new options for essential tremor, like focused ultrasound, which is a nice option for certain patients, but not everybody. But I do think it's important, if you're considering a surgery like this, for Jamie, this is behind you, but is to seek out an expert opinion from a place that offers both options. Because obviously, if you don't offer focused ultrasound, your surgeon or your care team might be a bit biased towards what they can offer, which is understandable. But at the same time, you have to be an advocate for yourself and know that there are other options out there. And like Jamie said, I think it's really important to push back a little bit. I've had patients say, they would call me and say, you said that I wasn't a deep brain stimulation candidate. I have to get focused ultrasound, but I really want treatment on the other side of my body. Will you consider it? My advice, based on my experience, would potentially be to start on one side of the body. But if you're really bothered by the other side, sure. I think that's reasonable. And so I believe in that kind of partnership with your patients in a way. But patients also need to be educated so they can be advocates for themselves. The problem is that it's hard to get that education. So that's why we're doing this, And, Jamie, I remember when you said you had this sort of Facebook support group, and I said to myself, maybe you and I could partner in this. And like I, mentioned earlier, essential tremor needs a champion. And now with Zoom and social media, it's much easier to be a champion, Jamie. And, not to put a huge, responsibility on your plate. Of course, we could do it together. But I think you could have a major impact in this. You're a specialist in movement disorders with your pharmaceutical background.
Mm-hmm.
And so, I think it'd be really great for patients, and it'd be great for the field to have somebody like you be a champion, just like you're doing.
Yes, it's a passion for me in life. It's so funny. I spent my entire life trying to hide the essential tremor, But now I try to motivate everyone to come together and be public about it, and let's figure it out and do what we can to make it better and not be embarrassed.
Yeah, I think it's really great.
Yeah.
So now you've been with your Boston Scientific system now for over a year.
Hmm.
And I know that you're eager to potentially come back for some more programming because of COVID. There was a little bit of a disconnect there. I totally understandable, but it sounds like overall you're doing well.
Yes.
What was your experience, by the way, after that, surgery? Any discomfort or pain or anything that surprised you?
No, the battery swap is really easy. Um, just went in that morning. I think it was a couple hours, and it's really not painful at all. You just have some stitches on your chest. I'm very happy with the Boston Scientific battery, and there's no lump on my chest at all. And then I brought my little stuff here. This is the charger. I just put it on like this, and it charges so easy. I actually like, not to get too personal, but that's who I am. I'll have it stuck to my chest and I'll walk to the bathroom, and like, it's not taped on me or anything, but I'll just kind of balance my body to keep it on, and it keeps charging. Where with the Boston Scientific uh, paddle charger, I was always trying to like move it and dig it around to find a good connection. So this one, I only charge like 15 minutes a day, and or sometimes I wait a few days and do it for a little bit longer. But it's just overall a much easier, more effective system for me.
The current recharger is the Boston Scientific one, but the one you had before was the Medtronic recharger. Is that right?
Correct.
Yeah,
And
I remember.
one time the Medtronic recharger wouldn't even connect to my battery, and actually had to come to your clinic
I
to
remember.
get, yeah, to get my system charged.
Yeah, rechargeables are important to consider for patients. Some patients don't want to be reminded that they have a device and have a responsibility to charge it. And I honor that. And we have options that are not rechargeable. But
Hmm.
if you are okay with that, it will last at least 15 years. And that means less surgeries. And you may or may not like your surgeon, but the less you see your surgeon, probably the better. And so I think less surgery is a lower risk profile and just a better experience for patients.
Yeah.
And in fact, I scheduled a sort of an emergency surgery for tomorrow for a battery that died in a patient who we did a Medtronic placement 2 years ago. And I tried to convince him to do a rechargeable with Boston, but he didn't want to be reminded and he didn't want to have to recharge. He said to me, I don't want to be reminded that I'm the bionic man. I just want to live my life and that's fine. And I said, let's place the same battery that you had. You had a nice result, but we'll see how you do. And of course he calls the clinic today and said, my battery just died.
Oh my gosh.
And I said, well, we'll get it done tomorrow. But what if I weren't in town? You'd have to go for a couple of weeks without, being addressed. And that would be hard to do.
Yeah.
So I'm going to see him in the morning and I'll talk to him about a rechargeable option. But as you know, the Medtronic rechargeable is very hard to use. It's very finicky. So I
Hmm.
actually so rarely used it because, lots of patients complained about it. So, but now with the Boston Scientific option, the rechargeable is much easier. And, my patients seem to really like it, and you're a super smart, young woman who's, tech savvy. A lot of my patients are, 80 plus. They may have some cognitive difficulty, and even those have had overall fairly straightforward experiences with recharging with the Boston battery. And when there is difficulty, we're always available to try to help troubleshoot. So,
Yeah.
but I'm glad that's been easy for you.
Thank you. Um, One question I did get from a person that was not able to attend during this time, and I was curious too, because I still have many years ahead of me, hopefully, so things
Many.
will keep progressing with the tremor. This person was asking if you have DBS, if you could also be a candidate for focus ultrasound.
Yeah, it's a really good question. So the answer is yes. However, the device would have to be removed or at least partially removed. So it's not an optimal situation. we've had some patients who had a DBS device and came to us asking us for focused ultrasound. I had not placed these devices, so they came from the outside. One of them needed a revision, and I offered the patient a revision or removal with focused ultrasound, and that patient opted for removal with focused ultrasound. But remember, that would only treat one hand. We are doing a trial right now here and nationally, treating tremor on both sides with focused ultrasound. We'll see how that goes. It's not currently broadly available. Maybe an option in the future. But for now, if you have a deep brain stimulation device on both sides and you want to get focused ultrasound, you'll have to make the decision to have likely the device removed, most likely, but then only have treatment on one side. So it turns out, many patients will be very happy with a solid treatment for their dominant hand. And that will restore a lot of the quality of life and overall function. But if you need the other side done, deep brain stimulation remains the safest way to do that. There is the possibility, Jamie, I'll mention that, and I've done this once before successfully, so you can see it's a rare need. But I've had patients with deep brain stimulators that also wanted a focused ultrasound, but their deep brain stimulator was helping them. So I wouldn't remove it. But they had some breakthrough tremor.
Yeah.
With that, you can't do focused ultrasound, but you can do stereotactic radiosurgery, basically focused radiation. Instead of focused ultrasound, it's focused radiation. And you can actually preserve the device for that. And I've done that successfully. And that was actually in a Parkinson's patient with tremor, where the electrodes are actually not placed in the same place where we placed your electrodes, Jamie. So when we took the patient for focused radiosurgery, we actually put the ablation in the tremor target, not the Parkinson's target. And actually was very helpful for that patient. The problem with radiosurgery or radiation is that it's a delayed benefit. But as long as a patient's willing to wait a few months, actually radiation can be very helpful. But since focused ultrasound requires being in an MRI scanner, it's hard to do that with a deep brain stimulation device. Though many of our devices now are MRI compatible, but that doesn't mean you can get any MRI scan. It has to be a sort of a limited amount of MRI scanning.
Right. Well, thank you for answering that. I will relay the message.
Jamie?
And I know we're going to post a recording of this as well, so I'll relay your Gmail address, so I'm sure
Yes.
we'll get some more questions.
No tremor left behind at gmail.com. It's pretty easy to remember, but please do post it, and I'll probably do the same because I think I get a lot of emails there, but it's obviously not something that is broadly out there, and I manage it myself, so my responses aren't that quick, but I do the best I can, and we'll see how we can maybe grow that infrastructure as the need grows. Jamie, there's a bunch of people on the call. I really enjoyed having coffee with you over Zoom, but it was nice to have people who either have tremor or relate with your problem, or fellow champions in this endeavor listen into our conversation. I haven't taken, I don't know if you have any other questions for me, Jamie, or if anybody wanted to ask maybe a question. We have maybe 10 more minutes on the call if people would like to chime in.
I think there's some in the chat session. Leslie, are you still with us?
I am. I don't see any. Well, there's 2 questions in the chat. I don't see any new questions.
Okay, go ahead and start with the first one, and then we can go to the audience.
Is it available to you, or do you want me to read the question?
Go for it, Leslie.
Okay.
Leslie, I think because I logged out and logged back in, I'm not seeing those chats. So mine is blank at the moment. So I'd appreciate it if you could read it. Thank you.
Yeah, I apologize. My keyboard on this computer is a little sticky, so I'm trying to find my cursor.
By the way, were you on Safari? Where's that picture?
That is from South Africa.
Oh my gosh, this is like a dream trip of mine.
Oh my goodness. Well, hopefully if COVID lifts, we'll go back again in August. So.
Oh my gosh, that's amazing.
So I did meet you before, if you recall, Dr. Halpern. I've been with Jamie to see you
I
a
remember.
couple of times. And I'm actually in the process right now of texting a girlfriend, my Pilates instructor,
Oh,
whose boyfriend just had DBS done at in San Francisco
oh,
at
sure.
USF. And so we're actually texting it during the talk here. So
Oh, that's
hold on.
great. So we're
I
getting
have-
the word out there. I hope everything went well. They have a great team in San Francisco, so I'm sure everything went great.
He went with the Boston Scientific Battery, I'll tell you that.
Good.
Anyway, hold on 1 second while I work on this this cursor. Just
Actually, I can probably do it if you need. The first one, I'm not sure I can pronounce. Acetyl L-carnitine has been a point of study for many different conditions. Do you think that it's beneficial, and has there been any recent clinical studies to its efficaciousness in treating benign tremors?
Oh, I wish I knew the answer to that. To be honest, I'm from Philadelphia, so I'm a very direct kind of person. If I know something, I'll tell you. If I don't, I'll also tell you at my own sort of peril. There are a number of medications being studied. I believe that medication is being studied for Parkinson's. I am not a pharmacology expert. I'm more of a procedural expert. I can tell you if that's the medication that I recollect from my review from another patient who asked me about it. It provided Parkinson's symptoms relief about 10 to 15%, meaning the severity of the symptoms decreased a bit. So if that extends to essential tremor, it might help a bit. I don't think it'll be a transformative option. That being said, I would not also consider myself to be an expert on it. Rather, more just a peripheral user of medications for disorders, because I usually am asked to, offer procedures for patients who have failed medications. So I apologize. I would double check my answer and go with an expert on that one.
Great, thank you.
Yeah.
The next one is, what can you share about Stanford bioengineer Stanley Q studies involving CRISPR and its possible application to treat or perhaps repair areas in the brain affected by neurological disorders?
It's very exciting work. This audience, my gosh, is going to challenge me. I'm impressed, but this happens a lot in the Bay Area. But yeah. I will say that you need a strong basic scientist, the members of that lab to answer that question really well. I can tell you there's lots of promise, but it's far away for essential tremor specifically. But definitely something exciting, and I'm really impressed that you know about that work. Thank you.
I've heard a lot about CRISPR, but I haven't done my own research either.
Yeah, it's a hot topic at Stanford.
Yeah. So that's all we have in chat. So I guess.
Jamie, I have one here. What are the factors that would eliminate someone from being a DBS candidate? Also, if we want to talk with Jamie directly, can we do that? Would she share her contact info? Is there a benefit to FUS over DBS?
Oh, focus ultrasound. Yeah, I prefer to message people through Facebook. My Facebook page, you can find me. It's Jamie K. Denton. Shoot me a message and I'll respond to any questions.
Those are great questions for me, by the way. I think I can answer them as good or better than most. So I appreciate that question. Leslie, so I don't miss anything. The first question was, what would exclude somebody from being a candidate, I believe?
Yes. What are the factors that would eliminate someone from being a DBS candidate?
Yeah. So, well, let's take that one step at a time. So first, Jamie mentioned earlier that she was sort of told by her neurologist at one point that, she really wasn't ready for deep brain stimulation. I have a tough time with that concept because, and I agree with Jamie, and I know that happened, and that happens all the time. But neurologists often, their philosophy is that you really need to demonstrate severity before proceeding with something like deep brain stimulation or focused ultrasound. And I think I understand where they're coming from, but at the same time, you know, it's not really up to them if you're severe or not. It's kind of up to you. So I would say if you feel like your tremor is causing you severe disability, you know, that should be something that should be considered. So you shouldn't be excluded because you're mild. You should be excluded maybe because of other reasons. However, of course, when I see patients that I think are mild, I often say to them, listen, you know, it is likely you might need my help at some point. There are some risks with what we do, and so we can't just offer it to everyone. However, if your tremor gets to a point where your quality of life is severely disabled, your professional life is disabled, and you're not able to enjoy life the way you think you should, then we should really consider procedural options. Of course, if things are way too mild, it may not be appropriate. So that would be one exclusion. However, I do think that these procedures are withheld from people that have relatively mild problems, but they should not be withheld. And so I do feel that, you know, Jamie's, you know, neurology team originally probably withheld a treatment that she would have benefited from much earlier. So I do try to get these treatments, you know, in place much earlier on now for that reason. But perhaps really mild tremor, that would be an exclusion. The other one that's perhaps more pressing are things like cognitive problems, like memory difficulty. If you're having memory difficulty and cognitive problems or severe depression or severe anxiety, these are things that either have to be better understood before you proceed with surgery. Perhaps if they're way too severe, you would not be able to successfully have surgery because the risks would be too high. If the depression or the anxiety are the issue, there are ways to get those under control, and good to do that before the surgery. So those are some things to keep in mind. Severe medical comorbidities, out of control diabetes, out of control hypertension, recent heart attacks, severe lung disease. These are other things that would make it so you're not a candidate. Patients that have pacemakers can get deep brain stimulation, but you might not be able to get an MRI scan, but we can still do it for tremor using CAT scan technology. But, you know, often people are told if they have a device, they can't get an MRI scan, so then they can't get deep brain stimulation. But in my clinic, that's not an exclusion. I think that people need to be understanding that this is not a cure. And so if I have a patient who's expecting a cure, I might withhold the surgery temporarily until I can kind of get them to better understand that this is not a cure. I did have a patient recently who I told him I would expect 80 to 90% improvement in tremor. And he said to me, so I might still have a little bit of tremor? And I said, yes. And he canceled the surgery. So I didn't cancel it, he did. So some people, you know, their expectations might be a little too high for something like this. But if, you know, Jamie, who's our poster child, is an example, we have wonderful outcomes. They're not cures, but they can really help patients. But expectations need to be somewhat appropriate. I think those are the primary ones that come to mind. Regarding focused ultrasound versus deep brain stimulation, there's a lot of factors at play. And one of those factors is a personal decision. So depending on where that question was coming from, sometimes the personality dictates which one we do. The obvious difference right now is that deep brain stimulation can be done on both sides of the brain, whereas focused ultrasound is done on one side of the brain, usually for the dominant hand. And so those are the primary differences. Because focused ultrasound does not require a device implant, it may be better for patients who are more elderly. It may be better for patients who can't get easy access to somebody to program their device. And it probably is better for patients who have a history of infections, because a history of infections, by the way, could be an exclusion for deep brain stimulation. So those are the kinds of things that I have in mind when I see patients and try to counsel them on one versus the other. I think there may have been a third question, but I don't recall.
Well, Lisa O'Donnell's question was regarding the memory issues. And Lisa, was your question addressed satisfactorily?
Yes, thank you.
Oh, it's my pleasure. And Leslie, I didn't recognize you with the cowboy hat and the sunglasses, but now I do. It's nice to see you again.
my number one caretaker there.
Yeah, wonderful friend.
So I guess we can open it up to the audience if anyone had any questions.
So there is another question that just came in from Diane. My hearing specialist wants to perform a cochlear implant in my right ear. Could I still have DBS surgery on my left side for I am left-handed?
Yes, no problem. Wouldn't be a problem for me at least. But you might consider doing the DBS first if you can, but if you can't, it is still possible.
Great.
That's all I've got right now.
You know, and I do see the chat now, Leslie. I think it was because I was logged off before, but now since I've been on for a bit, I that last one I did see. So you might be relieved of your duties.
Good, I have another board meeting to go to soon. Anyway.
Okay.
But this was very, very enlightening for me. It helps me to understand more of where Jamie's been, and I think it's
Yeah.
helpful to the people who love the people who are considering DBS to have a better understanding of the impact and how we can help support them. So it was helpful for me. Thank you.
Yeah, you know, I agree, Leslie. You know, Jamie, you've had 2 life experiences with tremor that are both are equally as important for patients to hear. And I think you've articulated them so nicely, and we need more people like you to help. But, you know, you don't have to live your life with severe tremor if you're willing to consider a procedure like this. If you have a procedure like this, it might be enormously helpful for you. But if you're having side effects, there are likely ways to address them. And it's important to consider things like a battery swap, or I call it a battery upgrade, such that you can get these better outcomes. And there are people who are experts or consider themselves to be experts who may advise against it because of the lack of experience with it. However, there are plenty of people that have great experiences with it. You know, Jamie and I are 2 of them, but there are many more. And this is going to be a growing opportunity for patients. And I can say, Jamie, you have joined a collective group of over 50 patients of mine. I think we're now at about 75 who we've done these upgrades for. I mean that somewhat jovially, but not entirely. And I'll tell you, I love doing surgery for patients. I really do. Like, this is why I'm here. But I'll tell you, some of my most grateful patients are patients that I just did a battery swap for.
Mhm.
And that swap is a relatively minor procedure. It's outpatient. It's not painless, but it's, you know, it's pretty well tolerated.
Very easy.
Very easy, yeah. And some of my patients like you just were so grateful just from that small procedure. And it really is inspiring to me. And I've always said, you know, we're not doing surgery to have fun. We're doing surgery to help patients. And if these minor procedures can be helpful, we need to promote them, educate people about them. And I'm really glad we're doing this for that reason.
Yeah. And Dr. Halpern, I don't know if Pam wants to come off mute at all, but she lives in Ohio.
Oh, yeah.
And we manage the whole conversation over Facebook, and I'm so happy to hear that you're getting that patient in so quickly, because Pam had the unfortunate experience of her Medtronic dying right before Christmas.
Oh.
And they could not get her in for the new battery for a while. Hi, Pam.
Hi, Pam.
Hi.
How you doing?
It's been exactly a week since I had the Boston Scientific put in.
How are you feeling?
I feel great.
Fantastic. And your tremor is well controlled?
Yeah, I mean, I still have spells of it, but it's a lot better than it was with the Medtronic.
Oh, I'm so happy to hear that. I'm sorry that your holiday got a little bit disrupted.
Oh, it was a mess. And I had just had aortic valve replacement.
Yeah.
So my vascular surgeon wouldn't okay me to have the battery replaced until January. So I had to go a month with it completely dead.
Oh, I'm so sorry to hear that.
But
But
I can talk again.
Yeah.
My voice was terrible.
And did you get programmed after the battery change, or are you on the same settings as you were before, just with an upgraded battery?
Just upgraded. I go in the 3rd to get
You know,
programmed.
so Jamie, you and Pam, I think both had benefits just from the battery change on the same settings as the Medtronic system.
mhm,
And I've been asking the question, how can that be? Why is this? It seems that the stimulation is just more stable. Why are patients actually feeling better just from a battery change, even before they get programmed? And I've learned the way the Medtronic system was engineered that there are dropouts in stimulation that no one really is aware of except for the engineers that made the devices. And the dropouts are very brief and presumably not clinically significant.
mhm.
But guess what? They're clinically significant. And that's why some of these patients like you and Pam are seeing these kinds of benefits.
Yeah.
But I would
Well,
say, I will tell you,
Go ahead, I'm sorry.
oh, it's so easy to interrupt each other on Zoom. And, I'm very excited about this stuff. So I'm a bit of a chatty Cathy. But, I just wanted to say, Pam, that I suspect when you go in for programming, that little bit of slurred speech that I do here, they're going to make that better.
Oh, I'm sure.
I wish
I'm
I could do
sure
it for
they
you
will.
remotely, right? I wish I could do it for you right now remotely.
I wish you could too.
We should talk to Zoom and Boston Scientific. Maybe they can, join forces.
But my surgeon has been on the Essential Tremor site too,
That's great.
Dr. Krishna at Ohio State.
Oh yeah. I know him well. That's wonderful. He's taking good care of you.
I think the world of him.
Tell him I said hello. We're a small community. We all know each other.
Oh, really?
Absolutely.
And I just wanted to
Yeah.
point this story out because we've been able to reach people across the country, actually across the world. A lot of the websites have a lot of people from the UK. Pam and I would have never ever met. But here we are just because I posted a story about how things changed my life, and we're all coming together. So I just really appreciate you, Dr. Halpern. I appreciate you, Pam, for coming on and saying hello and letting us know you're doing great.
I owe you so much, Jamie.
Aw, thank you. You
Jamie,
make
you're
me
already
cry.
doing it. You're the Michael J. Fox for Essential Tremor, Jamie.
She is.
Jamie, do you have time for one more question from Lisa O'Donnell?
Sure.
Yes.
If the local surgeon or system only uses Medtronic, would you advise to travel for a different doctor? And what does that mean for programming the device?
There are surgeons and neurologists that will not use anything but Medtronic. There's also surgeons and neurologists that won't use anything but Boston Scientific. And also, to be fair, there's an Abbott system. And there are people that won't use anything but Abbott. And there's a lot of reasons for that. And just to inform you, one of those reasons might be because they've never used anything else. I think that's unfortunate because I think it's our job to be innovative as physicians, but that's a reality. The other reason that might be out of their control is that their hospital won't let them. So it's important to know it might not be their fault. Their hospital may have contracts and they can't violate them with Medtronic, for example. And Medtronic is notorious for building those contracts. But so are other companies. So I can't say it's the wrong thing to do. These companies, they're companies, and this is capitalistic. So it is what it is. What I would advise, without knowing where you are, Emory uses Boston Scientific, by the way, if I'm reading that correctly. But in general, let's say there's people on the call that aren't in Atlanta, for example. It is important to have somebody that you trust. And I'm seeing the chat. Yes, please follow up with them. You don't have to say that I told you they use Boston Scientific, but you can say that there are patients there with Boston Scientific, and a few of them are mine. the chief of movement disorders at Emory, she has experience with Boston Scientific. And Bob Gross is a neurosurgeon at Emory, and he has experience with Boston Scientific, I believe. I would be sad if he didn't. He's a very good guy. What I would say is, if you have DBS and you're having a good outcome and you're not having tons of side effects and your tremor is under control, it may not be critical to upgrade to something else or change. You know, when it ain't broke, don't fix it. There is some truth to that. At the same time, it is likely your tremor will progress over time, slowly. So having a device that is more flexible would be ideal. I think the question is it worth traveling for? And my answer to that is it probably depends on how far you have to travel, especially during a pandemic. And I suppose I would say I would rather have a neurologist and or a neurosurgeon that are really engaged in my care with the Medtronic system than somebody using perhaps a more sophisticated device that I don't know. So if you're with somebody that you trust, I think that's first and foremost the most important. You know, I think, you know, you'll still have a really good outcome. You know, we had tons of great outcomes with the Medtronic system. It's just that it seems that the Boston Scientific system provides some advantages. I would hate for you to, you know, end a relationship with a good neurologist, you know, over a device. So sometimes just asking and probing, you know, by the way, sometimes if their hospital has contracts, that doesn't mean that one time they can deviate from that. So a little bit of pushback usually can get you what you need to get you what you want to have. So let me know if I can help in any way. You can email me at notremorleftbehind@gmail.com. And I'm reading your note. Dr. B. I don't know if that's the name of the person because I'm trying to go from memory who it is, but the chief of neurology is a female movement disorder specialist. She's wonderful. And I know she has Boston experience. Anything else? There's some familiar faces on the line. I don't want to, you know, it's always a little bit stressful to speak kind of publicly, even on Zoom. So I don't want people to chime in unless they want to, but I hope everyone really enjoyed the meeting and got your questions answered. And it is nice to see familiar faces.
Thank you so much for volunteering your time, Dr. Halpern, to reach out to people. And this meeting will go even further as we post the recording. So I really appreciate you taking the time, and I appreciate you letting me share my story on this platform. And to everyone who joined, thank you so much. And thank you, Leslie, for helping us moderate.
Thank you so much to our moderator, Leslie. And
Pleasure
also
to be
being
part
such
of it. Thank you.
And thank you for being such a great advocate and a friend to Jamie. And Jamie, it's really just been such a, you know, a wonderful experience being able to take care of you and kind of help you through this difficult problem. And seeing you on the other side of it now doing so well is just for me, you know, I always tell patients that if they consent to this surgery, it's like a gift for me because, you know, I know it's going to help a lot. And that's for us very, very rewarding. And it is a team effort, I have to say, both the patient, the doctor, my whole team in the clinic, you know, it really does. My mother always says it takes a village. It's kind of a corny saying, but it really does. And part of that village is the patients being willing to entrust their care in our hands, literally.
Yeah.
So thank you for that, and thank you for helping arrange this. And let's do this again soon.
Let's do
Jamie's
it.
a rock star. We love you, Jamie.
Thank you. I love you all as well. And
Thank you
I'll
all.
see you soon. Have a good evening.
You too, Jamie. I hope this was helpful.
It was. Thank you.
Bye now.